I think the question I would ask a patient who's going through a flare to ask him or herself is, do I really need to do all of this in my day? How can I prioritize? What's important for me to complete in terms of a task in a day? What should I let go of? How can I carve some time to get some rest? Because it is true that many of my patients, they tell me that rest and pacing themselves are the key strategies that they use. And when we have done research on RA flares and what patients do in terms of self-management, these two seem to be the most important. I think it is very important that when you go and see your rheumatologist for your routine follow-up, to actually sit down and make a plan about how to approach a flare, when to reach out to your rheumatologist. And I think it's also very important to log the number of flares you're having between your clinic visits. Remember, as RA patients, you are going to be on medications, whether it's methotrexate, leflunomide, or biologics, that can put you at risk for infections. So anytime you have a flare that's unusual, anytime there are fevers, rashes, or anything else that is just not typical of your flare, please reach out to your rheumatologist. But at the same time, if you have a flare which is much worse than what you can deal with, or even if it's not that worse, but you are just concerned about how it is affecting you, reach out to your rheumatologist. We would rather hear from you earlier than later.